Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We're going to be speaking with Rich Birhanzel this morning. He's joining us here from Accenture Health to talk about the takeaways of the 2021 Accenture Health and Life Sciences Experience Survey. Welcome to Health Professional Radio. Rich Birhanzel, thanks for taking the time.
Thank you.
Well, give us your professional background and talk about your role at Accenture.
I've spent most of my career helping payers and providers in the healthcare system serve their clients more effectively. I'm currently the global health industry lead at Accenture. Our focus at Accenture and the way we serve our clients is to help those clients improve access, experience, and outcomes for the people they serve, powered by technology and human ingenuity. That's what our focus is.
Obviously, healthcare is changing due to just the pandemic alone, let alone what was going on before the pandemic hit. In your opinion, how is healthcare changing? Is it going permanently away from the hands-on personal visit? Are we moving toward remote care exclusively?
It's a really interesting question in that prior to COVID-19 and the pandemic, we saw fairly modest use of virtual care and other forms of remote care. We have definitely witnessed an increase in both. In our survey we've recently conducted, we looked at this very closely and learned that the virtual consultation, or what might be known as virtual care, rose to a steady state of about 32%. And prior to the pandemic, it was just around 7% or perhaps less. The use of other tools also increased, but notably at the same time, we saw a decrease in the use of social media and other forms of support communities, which is a little bit odd given the isolation that many faced during the pandemic. We do think that the virtual care will be a persistent part of the way people receive care. It will not replace in-person care, but it will be a complement to that, and it's a choice, and it will be a preferred choice for some who want to have a channel that is more just-in-time and more available anywhere they may be. But there is still a fairly significant number of people. There are a number of people that still will prefer to be in person with their physician or nurse.
The 2021 Accenture Health and Life Sciences Experience Survey. We've been talking about how healthcare has changed. Did you conduct this survey to get a look at changes from a practitioner standpoint or a patient standpoint, a payer? Who was this survey intended to inform?
We were really trying to understand the sentiment of people, those that are engaging in the healthcare system, and we did so that we can better serve our clients who are payers and providers.
As far as the changing landscape of care, what about the changing landscape of expectations of patients? Is that something that was addressed in this survey, and some of the expectations of practitioners from their patients?
The survey really focused on 4 areas. We looked at experience, we looked at access, we looked at technology, and we looked at trust. On the dimension of technology, we're seeing an increase and really an acceleration around the availability of technology. But with that comes some expectations. People expect, you and I and other people who experience the healthcare system, expect the different people that we engage in to get care, whether that's acute care or maybe it's just a routine checkup. We want that information to be connected. We want people to be aware of our history, of our preferences. And so while technology has improved and it's accelerating in terms of innovation, the connectivity of it, the availability of it, and also the use of it to tune the experience to something that I personally want to have as a consumer, as a patient, is critically important, and that is an expectation that we're seeing.
As far as that experience, are we talking throughout procedures, say from visit to procedure to recovery as well? Are all of those expectations changing as well?
Yeah, they really are. And that's another dimension of the expectation, is that it's holistic. Regardless of whether someone has an acute illness or someone has an injury, or maybe they're generally speaking well, they're still expecting that their experience throughout those moments where they engage the healthcare system are consistent, that they're tuned to their personal preference. We looked also at how people reacted to and thought about that experience. So what is the sentiment? What is happening today? And it was interesting to see that a good majority of people have had negative experiences with the healthcare system. And the thing that, in fact, only 1 of 3 haven't had it. So 2 of 3 have had a negative experience. What has been viewed as very important and a positive element that can improve experience is when the healthcare provider is able to explain the condition and treatment clearly. Mm-hmm. So that's about enabling that physician or nurse to do that with the right technology, the right information at the right time. And the other one that's really notable from the whole study, I would say maybe the key point, is that listening and understanding patients' needs and providing emotional support was cited as just as important as the care experience itself, or whether someone at the front desk is nice to the individual. This is an important learning in terms of providing that kind of emotional support that people need, and we're learning so much more about the connection between medical care and behavioral health, and this really brings it to light in terms of the human expectation around their engagement with care delivery folks.
When it comes to that level of trust, are we seeing patients being more trusting, less trusting of their physicians and medical institutions? And if so, is that because of some of the lessons that we've been learning in the last couple of years, or not? The
trust is an interesting subject, and we did look at this. Of those people that are affected with negative experiences, and as you recall, I mentioned as many as 2/3 have been affected, a vast majority of them, 88% of them, are affected by those negative experiences in a way that limits their healthcare effectiveness. Now, let me explore that for just a moment. When we talk about healthcare effectiveness, one consequence is 1/3, 34%, switched providers or treatments, or were less likely to seek medical care the next time they needed it. And then others chose not to keep up with treatment, or they didn't even pick up their prescription because of the poor experiences. So as we can see, that has a direct impact on outcomes. That affects cost. It affects the quality of care. And then ultimately, it also affects the durability of the relationship that patient has with their provider or even with their health plan.
Going forward, what would you say is the outlook of the healthcare industry?
We see a real great opportunity here for improvement, shifting the focus to the human experience. The technology is advanced to a stage where it really can enable personalization. It really can enable the physician, the nurse, and others to engage with the person at their moment, at the moment they are treating them, and have the right information, not just about their medical history, but also about their preferences, how they like to receive information, what their expectations are, and the nature of the conversation. So with data, with artificial intelligence, and other technology solutions that can support the care delivery team, we see a real opportunity to move this to a place where people feel like their experience is tailored to them. And it is, and what we're going to see then is an improved outcome, because people will be more engaged, they'll sustain, they will be more likely to be compliant with with whatever's prescribed to them or whatever treatment they're asked to pursue, and that drives benefit to all in the system. But we have to harness that. We have to harness technology and the human ingenuity that comes from the amazing people that we have in our medical community.
Rich, where can our listeners go online and get some more information about Accenture Health?
You can get to our information right at Accenture.com, our website, and we have more to share there on this study as well as our broader thinking on the industry.
And that's www.accenture.com. Rich, I appreciate you joining us here on Health Professional Radio this morning. Thank you so much.
Thank you. Really appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Rich Birhanzel, Senior Managing Director, Global Health Lead at Accenture Health. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.